You know, when COVID first started, I think our biggest difficulty was dealing with the staff's anxiety and their fears around COVID, around working with patients who were COVID positive. And a lot of that fell on us as the management team of the hospital, where we had to often address the staff, speak to them individually, speak to them in groups. And at the same time, the managers also had to deal with their own fears of this disease. So it was a difficult time, and we quickly realized that we actually needed assistance to deal with this anxiety and this fear. So we had 3 counselors on site who provided some of that assistance, and they offered individual counseling sessions to whoever needed it, and group counseling sessions, and these 3 counselors were externally contracted. And then on top of that, what we also did is, and these were all initiatives that just came about, it wasn't something that we had planned, but our in-house psychiatrist, a psychologist, and one of our occupational health therapists who actually works in the mental health ward. The 3 of them got together and they started walking through the wards and just speaking to the staff, engaging them and offering group counseling sessions. And they ended up offering, over 1,000 consultations they did over the time period. And on top of that, we found that some of the staff categories seeked help more easily than other staff categories. So the doctors, for example, found it quite difficult to ask for help. And having the psychiatrists and the psychologists and this occupational therapist walking through the wards, they also then set up many of these sessions with the doctor groups. So there were many issues that came out of those sessions that allowed us to be able to address those immediately, be responsive and constructive in the way we dealt with this. So that was ongoing. And then myself as the CEO and the head of nursing, we also did walkabouts at least 2 to 3 times a week, just chatting to the staff, how you're doing, and picking up any problem areas if there were any. And there was a 3rd initiative on the go from one of our anaesthetists who started this project where he trained a group of people, and he's actually now trained over 30 people, and we're calling them compliance champions, not really compliance champions, but we're calling them wellness champions. And what they were trained to do is walk again through the wards, speak to the staff, counsel them, but what they also did was compliance audits. So they observed the staff, they watched how the staff were using their PPE, whether the PPE was appropriate for the action that they were performing, and whether they actually adhered to the guidelines as we had set them out. And over time, because we wanted people to use the PPE appropriately, and over a period of a month or a month and a half, we actually had improved that compliance quite considerably, from less than 40% to almost 70-80%. So we've learned that it's been an important aspect of staff wellness, and the staff had actually asked for it to continue because they found it so helpful. So we've amalgamated all 3 activities, and we actually have now decided that staff wellness and staff safety is our number 1 priority going forward for our planning phase and whatever actions we're going to implement. And we're busy drafting a strategy in that regard, and how that strategy will be divided into different phases. We've already identified that, and we're going to implement. So we want to use a wellness coordinator. We have one already, and then have a psychologist and probably a mental health trained occupational therapist as a team of people that are now going to run and implement this wellness strategy.